Most weight loss surgery patients are between the ages of 18 and 65, and then they have a body mass index of at least 35 with 2 associated medical comorbidities. Those are things like hypertension, hyperlipidemia, obstructive sleep apnea, or maybe diabetes. Also, patients that have a BMI of 40 without those medical comorbidities would qualify. The reason I think a sleeve gastrectomy is an excellent choice for weight loss is that it can be performed minimally invasive. I typically do this surgery robotically, so there's faster recovery, there's lower risk of infections, and there's less postoperative pain. This surgery provides excellent weight reduction without the complications associated with some of the more aggressive bariatric surgeries. It's about 6 to 8 weeks to have bariatric surgery. There's a process that we go through in our bariatric program of having the patient see a clinical psychologist, an exercise physiologist, and a clinical psychologist prior to surgical intervention. Current research shows that bariatric surgery is the most durable choice for weight loss long term. Drugs like Ozempic and Wegovy have had some success with weight loss, but there's been difficulties obtaining prescriptions for these for some patients and then even getting insurance approval for them. Their cost is very high, sometimes upward of $1,000 a month, and this is a drug that's got to be taken lifelong. Weight loss surgery allows a patient to obtain a more healthy body weight. Their weight in general is oftentimes what brings about the diabetes and the obstructive sleep apnea. When we can correct the excess body weight, we correct those medical conditions oftentimes. Weight loss surgery is not the easy way out. It's just a tool that we use to help people obtain better health and a more healthy body weight. It's not a quick or easy process. It's not an easy fix for anything in particular, but it is a tool that we use to get them to a healthier body weight. I think one of the biggest changes following weight loss surgery is improvements to mobility. We've got a lot of patients that have a difficult time with general family activities, and then once they've had surgery and they've had success with their weight loss, they're able to do things that they weren't able to do before. Insurance is the most common method that people have their surgery covered by, but also there's cash prices and care credit options. Here at Magnolia, we've got dedicated staff that are trained to take care of bariatric patients. We've got an OR suite that has been utilized just for this surgery. We have dedicated staff on the floors to take care of bariatric patients that have had specialized training, and then we've got specialized rooms for these patients as well. Here at Magnolia, we offer preoperative, operative, and postoperative support during all phases of your surgical intervention. Preoperatively, we have nutritional support as well as psychological support and a meeting with the exercise physiology to help formulate a plan to have a successful outcome. We have operative and perioperative. Following surgery, we've got a dedicated group of individuals that helps with the postoperative course. We also have a support group that meets on a quarterly basis to discuss concerns and things postoperatively that may come up.